So, treatment of internal hordeolum is similar to the external hordeolum, that is the stye, except that when the pus is formed, it should be drained by a vertical incision from the tarsal conjunctiva. So, when there is a pus formation and we need to drain it, so for the draining, a vertical incision from the tarsal conjunctiva is necessary in case of the internal hordeolum. Next is the fifth one, that is the molluscum contagiosum. The molluscum contagiosum, it is a viral infection of the eyelid, commonly affecting in the children, and it is caused by a large pox virus. Its typical lesions are multiple, pale, waxy, umbilicated swellings scattered over the skin near the lid margin, and these may be complicated by the chronic follicular conjunctivitis and superficial keratitis. The treatment of the molluscum contagiosum is that the skin region should be incised and the interior cauterized with the tincture of the iodine or poor carbonic acid. So, when we can see the molluscum contagiosum, it is a viral infection of the lid. So, there is an infection of the lid due to the viral infection commonly affecting the children, and there is a multiple pale, waxy, umbilicated swellings scattered over the skin area of the lid margin, and these may be complicated by the chronic follicular conjunctivitis and superficial keratitis. So, treatment of these is that there is a skin region should be incised and the interior cauterized with the tincture of iodine or poor carbolic acid. Next topic is the anomalies in the position of the lashes and the lid margin. So when there is a anomalies seen in the position of the lashes and the lid margin, then the many types are occur. Like first one is the trichiasis. Trichiasis, it refers to the inward misdirection of the cilia, which rub against the eyeball with the normal position of the lid margin and the inward turning of the eyelashes along with the lid margin that is seen in the entropion. It is called pseudotrichiasis. So, trichiasis is the inward misdirection of the cilia. When there is a rubbing of the eyeball, then there is a inward misdirection of the cilia which leads to the trichiasis. And the normal position of the lid margin, when there is the inward turning of the eyelashes along the lid margin, that is seen in entropion, so it is called as the pseudotrichiasis. Etiology Etiology is that when there is a common causes of trichiasis are cicatrizing trichoma, ulcerative blepharitis, healed membranous conjunctivitis, hordeolum externum, mechanical injuries, burns, and operative scar on the lid margin. So when there are the common causes are cicatrizing trichoma, ulcerative blepharitis, healed membranous conjunctivitis, Hordeolum externum, mechanical injury, burn, operative scar on the lid margin which lead to the trichiasis. The symptoms are that there is a foreign body sensation and photophobia, with the patient may feel troublesome irritation, pain, lacrimation. So there is a foreign body sensation, photophobia, irritation, pain, lacrimation. These are the symptoms of the trichiasis. So when we can see a diagram of the trichiasis, firstly this is A, that is the diagrammatic depiction, and second one is the clinical photograph of the trichosis. In that we can see how there is a inward misdirection of the cilia. So this is the inward misdirection of the cilia. In that case, we can see in this signs of trichosis is that there is examination reveal one or more misdirected cilia touching the cornea and reflex blepharospasm and the photophobia occur when the cornea is affected. Conjunctiva may be congested, signs of positive diseases, vice versa, that is trachoma, blepharitis, etc. may be present. So, we can examine the patient of the trichiasis, then we can see that there is a reflex blepharospasm and photophobia occur when the cornea is upgraded and conjunctiva is congested and signs of positive disease that is the trachoma, blepharitis, etc. may be present. And complication is that these include a recurrent corneal abrasion, superficial corneal opacities, corneal vascularization, and non-healing corneal ulcer. And treatment is that a few misdirected cilia may be treated by any of the following methods and epilation that mechanical removal with the forceps and it is temporary method as the recurrences occur within 3 to 4 weeks. So, in the complication, we can see that there is a corneal abrasion, superficial corneal opacities, corneal vascularization with the non-healing corneal ulcer due to the trichiasis. And treatment, firstly, there is a epilation, that mechanical removal of the cilia with using the forceps. Then second is the electrolysis, that is, it is a method of destroying the eyelash the lash follicle by the electric current, and in this technique the infiltration anesthesia is given to the lead and the current of 2 mA is passed for the 10 seconds through the fine needle inserted into the lash root. The loosened cilia with destroyed follicles are removed with the epilation process. Third one is the cryoflexion. In that, it is also an effective method of treating the trichiasis after the infiltration anesthesia, and the cryoprobe, that is minus 20 degrees Celsius, is applied for the 20 to 25 seconds to the external lid margin. And main disadvantage is the depigmentation of the skin. Fourth one is the surgical correction. When many cilia are misdirected, there is operative treatment similar to the superior entropy and should be employed. So, when we can study about the trichiasis, that is the anomalies in the position of the eyelashes and the lid margin, we can see that this is referred to the inward misdirection of the cilia. There is also pseudotrichosis, there is etiology and symptoms with their diagrammatic representation and the clinical photograph with signs, complication and treatment. So for the today, we can stop the lecture here. Till that, have a good day, and from the next lecture we learn about the entropion and the other terms.